Good afternoon from Thailand and a very warm welcome to everyone joining us today. I am Saranya Sucharit Pong from the Institute of Population and Social Research, or IPSR, at Mahidol University. And I have the pleasure of serving as your MC for this session. Today's event is titled Taxing Unhealthy Food, Improving Food Environments, Part 2. The messenger matters just as much as the message. This is the third webinar in our ongoing series, the Asia-Africa Learning Exchange in Food Policy Research and Advocacy. Let me briefly walk you through today's schedule. We will begin with two distinguished presentations on country-level experiences by Dr. Phairot Saonuam from Thailand and Mr. Munawar Hussain from Pakistan. Then followed by a panel discussion featuring three experts from Africa. We will then open the floor for your questions before concluding at 3:30 p.m. Bangkok time. Excited to let you know as well that we have a diverse group of audience registered to be joining this webinar from not only the countries in Asia and Africa, but from Western countries like Italy, the USA, to name but a few. So we trust that today's session will foster a rich exchange of ideas and inspire collective learning. With that, let us begin. So it's my pleasure to introduce our first speaker, Dr. Phairot Saonuam, Deputy Chief Executive Officer at the Thai Health Promotion Foundation, or in short, Thai Health. Dr. Saonuam is a medical doctor by training and as a leading expert in health promotion in Thailand, focusing on NCD prevention, physical activity, and fiscal policies like the sugar tax to improve population of Thais. He will be sharing insights on the strategic importance of the messenger in the area of health promotion in general, and particular fiscal policy advocacy in Thailand. Please join me welcoming Dr. Saonuam.
Good morning, good afternoon, everyone. I am Dr. Phairot Saonuam from Thai Health Promotion. Thank you, Dr. Saranya, for your introduction. Today, I will share the Thailand experience in the health promotion policy using SSV tax as a case study and very important how policy ecosystem can make such change possible. As you know, that NCD is a global body policy for Thailand. We have 400,000 deaths per year. 3 out of 4 is dead by NCD, and this factor, as you know, that is leading by the high blood sugar, tobacco, alcohol, the actually risk, air pollution, alcohol use, and for Thailand, we run the system for NCD prevention like an ecosystem. For Thai Health, we emphasize our works on movement, but in parallel, Ministry of Public Health and National Security Health Office who take care of Thai people about the treatment side. So we are working together, health promotion and disease treatment. Thai Health Promotion Foundation, we established in 2000. Our revenue is coming from the social tax from tobacco and alcohol taxation. Is about 2%. When comparing to the government budget, it's really small. So Thai Health revenue, we can use it like a catalyst, not the bloodstream for the ecosystem. That's why Thai Health, we selected what should we do about the health priority, and the NCD is our priority. The main message for this slide is that Thailand is the catalyst for the Thailand health system, not just the main actor. And the mechanism for the EMR right now is fast spreading worldwide. More than 40%, 40 countries have implemented the EMR as a win-win strategy because the government have message and then is work on reform is also prevent the disease and the so it's a win-win situation. This would be if the Africa and many countries can apply this idea in the country. We apply the diagram and wisdom content is with the combination of the three powers together. First thing is the knowledge and research part. Should be run to identify what should be done, what is the recommendation, the current research. The current research has tell you what should do, and then lead to the policy movement and in parallel, choose in highlight on social mobilization because this is the work that can reach out to your people and the people themselves can encourage the policy to be better enforced. We apply the Ottawa Charter principle that apply home main strategy is to start by the healthy public policy, enabling development, community action, personal skill, and also reoriented health service. 5 things should be run together and Thailand and new country that we emphasize on the health promotion. We will remember the Ottawa Charter in Ottawa. And for the working multi-sexual organization is our principle because only one organization can do everything that. So you have to join hands with the Thai health itself. Has worked with many universities like a institution who have the research and the development and also set this to message the policy level. NGO or in the community or institute you have worked with the same background like the national committee professionals like to share the data and getting idea and planning together. May I go to the insight how Thailand we work on reducing sugar consumption. May I start with the data that Thailand is increasing on the level of sugar consumption than full time by national recommendation. At early, we try to raising the awareness to people by the public campaign. Many campaigns, when I raise only one example is the sugar disease. We use the online media, living media to give the message directly to people, but not enough because we have to rethink again because the main amount of our sugar is coming from drinking. The source is the soda beer. So we have to emphasize on what should be very done. That's why SCB tax should be our measure in the rate framework is the graph that show the uprising trend on the sugar drinking on the soda beverage comparing to sugar other foods. We also have the sweet enough at 4 grams campaign by reducing the package of the sugar serving in the coffee shop, in the many restaurant, but only through campaign is not enough. That's why the taxation is coming. We use the data published in the Lancet and the unhealthy food and beverage tax is the first priority and first highest effectiveness to prevent the obesity. After we introduce the SSB tax in Thailand, the number of revenue by sugar volume got by the excise very surprising because annually is high and 3 years later the number the revenue is going down. That reflects what not is a failure, but is a success because the business side has reformulated the sugar concentration. The primary goals of SCB is not raising the taxation by government. We would like to see the reform by the business side. So after we introduce SCB tax, is achieve our goals and the business. We reformulate the sugar and the concentration in many beverage is also reducing. After 2 years of implementation, the national consumption level of sugar in Thailand is down, going down. It's first time going down. That's I think this is our success on SCB tax, but it still have the challenges, because the NCD is still our problem. Our works in the past by SCB tax as we documented by movement. You can go inside and explore our idea in detail by reading the recent learn from Thailand with regulation and controversy. The SB tax measure is so important in this document. And our effort have got the award from the UN. May I appreciate the Department of Health, Department of Public Health in Thailand. He has the key person to run this measure. For Thai Health, we have the health promotion organization. We support working because it is a national priority. So we use our limited resource to make the key persons better understand, better building and work with work with Mandarin University and IDS to generate the evidence, support our data, national data to the policy level. That's why the policy can make a decision. And Thai Health we contribute many sector, particularly the one health sector, like Ministry of Finance, to make the SSC tax possible, and use many for policy for the platform. Talking in this fashion, like multi-sectoral, this is a part of the social organization that can support SCB implementation entire 4 phase of SCB tax development for the land foundation, integration, multi-sectoral collaboration, and until the fiscal policy exists. For the challenge and way forward, I think our innovative and sustainability and sustainable financing mechanism of Thai Health that should be mentioned because many countries we didn't have this mechanism, and the limited resource. If you can put in the right issue and right effort, it make the entire system move well. Political commitment is a challenge as well because at Ministry of Finance cannot develop this because they have to wait for the decision of the higher level like still of finance. So I cannot guarantee that in the future this measure still be run because Thailand can change our law at any time. For the third thing of our challenge is a whole government and whole society and one organization is not enough. We have to join with the non-health and health sector together. And convenient to overcome commercial demand of health. Commercial is more than the trading. That is combined the supply side, demand side, and commercial sector. We have to understand and work with them and work for support the primary goal to decrease the SSV tax, not work fully for decrease their profit. Many things can win-win situation if they shift from the IS concentration of SS sweetening to low sugar level. They still have the profit with the good health at average. And for my last challenge is we have to work with the setting approach to school, to workplace, to community, and use the non-health measure in parallel with using non-tax measure with tax measure together in the setting in school, banning the so that we in the workplace we encourage for the different. May I end my presentation overview of your promotion and the title on SCP tax, and in my success is that now decrease the level of sugar consumption. Thank you very much.
Okay, thanks very much, Dr. Saunawam, for your insightful presentation. I think for the first presentation, we are excited already to hear the success story of the sugar tax implementation in Thailand with the lead of Thai Health. So let's hear more from the second speaker, Mr. Munawar Hussain. Mr. Hussain is a consultant with the Global Health Advocacy Incubator, or GHAI. Mr. Hussain is a public health advocate with extensive experience in nutrition policy, and he has been a key figure in Pakistan's advocacy for taxing sugar-sweetened beverages. Today, he will be sharing how important it is to get youth engaged in the process of developing and implementing the sugar tax in Pakistan. Mr. Hussain, the floor is yours.
Thank you so much, Sarunian. First of all, let me thank IDRC and Mahidol University for inviting me to share some insights from Pakistan's a youth engagement model that helped us to, in fact, achieving several policy victories in the country. And let me share my slides. I hope you can see my slides. Could you confirm if you can see my slides?
Yeah, we can see your slide.
Thank you so much. Thank you. And let me just give you a quick snapshot of the Pakistan's context, a country with over half of the deaths are contributed by non-communicable diseases. And in hypertension, Pakistan stands at third highest in the WHO AMRO region. And with 3 over every 10 deaths are contributed by cardiovascular disease. And that also accounts around 47 deaths per hour in the country with the cardiovascular disease. And globally, it is ranked top in prevalence of the diabetes, and over 35 million people are living with disease and set to reach 70 million by 2050 as per International Diabetes Federation 2025 statistics. And another important thing that would be you would be interested to know is 68% of the Pakistan's population is under the age of 30 years. And in order to achieve a health policy success, we divide our advocacy into 4 different stages. The first stage that is to analyze and help us to learn more about the context, that include the landscape analysis and set the policy objectives, and also to access the policy, assess policy pathways, and learn who the important players are. And then to collaborate, build partnerships and champions, and then develop a strategic plan, and also plan communication. And the third phase, where the advocacy campaigns are executed, that include influence decision makers and build a public support, and also proactively counter opposition. And the fourth important stage is that is about monitoring the implementation of the policy, and also sometime policy is passed, but it is important to keep it sustained and to defend as well. And also, if there are, based on the evolving situation, if there are more improvements that are required, and that also help to refine the campaign and make any further improvements. What we have learned from overall advocacy work, some of the key success drivers, that it is very important to understand the policy pathway and the key actors around that, who the important decision makers are and how the policy would change. And then it's important to build a multidimensional, strong coalition, bringing the like-minded people together from civil society, media, government, and health professionals and academicians. So they could be, in fact, they could together amplify the voices and the policy and can influence the decision making in the policy processes. And then the evidence-based communication, translating science into a meaningful advocacy messages, and then identification and engagement of the champions. And sometimes it's a very important that in the environment where we operate, the champion in the parliament, in the media, or even sometime in the civil society or a health professional, they could be a game changer. And then monitoring and proactively counting of opposition. Whenever you advocate for policy change, there are elements, especially the food industry, and there sometimes there are front groups, those who oppose such policies, and there should be a plan to proactively counter that opposition. And the youth engagement as a part of the larger strategy is extremely important, and that led us to achieving these successes in the country. And our youth engagement model consists of 4 different phases. And the first is the identification of the youth advocate, that start with the sensitization sessions with the university students, and also engaging social media, or also publishing sometimes the call for proposals, and the selection of the youth advocates, and then a background check ensuring that the youth advocates that we engage are actually, they are conflict of interest free and do not have any association with the food industry. Then training and the capacity strengthening, that starts with the need assessment and the training of on design and implementation of the advocacy campaign, and the provision of financial assistance, a very small amount ranging from USD $50 to $100 to a youth advocate, ensuring that sometimes their minor day-to-day cost does not hold them back for advancing their advocacy work. And then the implementation and support, execution of the project phase and the campaign, and then the technical support, and sometimes the youth advocates might need more technical resources in terms of trained speakers or the experts, and then we link them with the relevant resources as well. And then the performance measurement and ranking and recognition, those who perform, they are also recognized through certificates and awards. And then ensuring that this engagement is sustained through follow-ups and the refresher trainings and creation of the alumni, and keeping this engagement continued and sustainable. Some of the key activities which the youth advocates has done, and these are only a few, and which includes the sensitization sessions, arranging a policy dialogues and the roundtables, bringing in parliamentarians, key experts, and sometimes even their peer fellows to making sure that these voices are amplified. And then arranging rallies and walks on special days like World Diabetes Days, World Hypertension Day, and World Health Day, and etc. And then development and the dissemination of the digital media content. And these are very strategic moves sometime around the when the policy window is there and the policy and developments are happening around that, the Twitter trending, sending or issuing a public petition. These are the important interventions that has been done by the youth and or with the support of the youth advocates. And then the latter to the policymakers and the parliamentarians are other key decision makers in the process. And also a annual youth conference where this conference not only bring together the different young advocates together, but also it is a platform to recognize the top performers through awards and certificates. Some of the statistics in terms of metrics that I would like to share with you that our civil society partners have directly sensitized over 16,000 youth advocates in the country. And then there was 74 youth-led projects that were executed. And the direct outreach of these youth-led projects for over 41,000 in-person peoples or the youth or the policymaker that were sensitized. And then the indirect reach through digital media was around 3 million people. And then over 186 letters were sent to policymaker on different occasions when the policy were in progress. And then the several communication pieces that were distributed that includes over 250 pieces that includes press releases, op-eds, social medias, and the videos. And this really help us to in translating these into a key policy wins. And I would like to highlight two important policy wins that we had in Pakistan recently, and that include the excise tax increase by the federal government of Pakistan on all sweetened beverages, including juices and the drink with non-sugar sweeteners, by 20% of the retail price. And the other important policy victory was the Pakistan approved a national standard to limit industrially produced trans fatty acid to 2% of the total fat in all foods and putting Pakistan into best practice policy. Thank you so much. And if you need more information, you can always reach out to me on my email.
Thanks very much, Mr. Hussain. So we have heard from Mr. Hussain about the importance of youth as another messenger that we should take them into the equation when we push out the sugar tax implementation. So to dive deeper into how these messengers navigated different regional contexts, we now move to our panel discussion with three experts from Africa. The first panelist, Ms. Joy Amafa from Nigeria. Ms. Amafa works as in-country coordinator for food policy and nutrition programs at GHI Nigeria. Currently, she coordinates a coalition of civil society organizations, government agencies, and multilateral partners to advocate for healthy food policies aimed at reducing diet-related diseases. The next distinguished panelist is Ms. Martha Okutu, who bridges the gap between the courtroom and community health. Ms. Okutu is an advocate of the High Court of Kenya, as well as Senior Program Officer on Health and Governance at the Kenya Legal and Ethical Issues Network on HIV and AIDS, known as KELIN. Over the past 6 years, she has been actively involved with the legal mechanisms to enhance healthier diets, such as front of package labeling. The third panelist, Mr. John Tomey, who is a policy expert and advocate specializing in the critical intersection of fiscal justice and social equity. Based in Nairobi, Kenya, he serves as the policy officer of the Tax Justice Network Africa. In this role, he leads efforts to ensure that tax systems on unhealthy commodities across the continent are transparent, equitable, and capable of funding essential public services like healthcare and healthy diets. This discussion will be moderated by Ms. Madiha Ahmed, Senior Program Specialist at the International Development Research Center, IDRC in Canada. I now hand the floor over to Madiha.
Excellent. Thank you so much, Saronia. I appreciate it. Let's just make sure. Great to have you join us, Joy, Martha, and John. I am not seeing John's video. I'm hoping that we can also have him on screen with us. Ah, yes. Fantastic. Thank you all for making the time to join us. And this is a good segue from, we've had a conversation about let's say the institutional catalyst that is the Thai Health Promotion Foundation. And then we've talked about Pakistan and how involving youth and having them be leaders in the change process can be quite transformational. And then now let's bring that conversation into Africa. With that, actually, perhaps I will start with you, Martha. Dr. Peroj talked about the triangle that moves the mountain. I found that term very inspiring. And in that context, for instance, your work in Kenya, you work with a large network of actors across academia, civil society, government, and you work, particularly Kenya is quite interesting in their work on the double duty policy bundles, which include, as we said, work on front of pack labeling, marketing, sugar sweetened beverage taxes, the new nutrient profile model. Can you talk to us a little bit about how that model works and the role of yourself and Kellen in that for change?
Yes, thank you very much, and I'm happy to be here. So in Kenya, Kellen rather, started this engagement with Advocacy for Healthy Diet sometime in 2019. And for a long time, many organizations, institutions, both academic and research were working collaboratively with the government, yes, however, in silos. So as at 2023, the different stakeholders, including government, research, academia, civil society organizations, and some community members, as well as development partners, came together and saw it necessary for us to have a common voice. I think at the end of the day, we wanted to reduce the burden of NCDs in Kenya. NCDs in Kenya at the moment are causing 50% of hospital admissions in Kenya. It's affecting families and the GDP economically. So it was seen very important for us to come together for the different institutions to play their different roles and to apply their different expertise and work together to come up with the 4 policy bundles, that being the front of pack labeling laws, marketing restriction laws, fiscal policies, as well as food procurement policies. So in 2023, we started working together, and I am happy to say that after that extensive work, first of all, relying on research by the research institutions who are part of this movement, to come up with different laws and policies around the 4 key areas that I have mentioned. And we are at the point where we have drafts of these laws and are working collaboratively with the government to ensure that these laws are passed. So we have also been engaging different stakeholders, not only outside government, but also state actors. So we have been talking to the legislative bodies, which is the National Parliament of Kenya, the Senate, and just having that discussion such that when all these laws and policies are developed to help reduce the burden of NCDs, that once they get to their tables in Parliament, they're able to debate well and also speak from a common perspective. And that also includes the tax process, because every year Kenya develops a finance bill, and now this discussion on tasking or fiscal policies came up last year in the annual finance bill discussion, and it was brought up by someone who is a part of the legislature, a member of parliament. So that means that all the work we have been doing, all the networking and the stakeholder consultations have been fruitful, because if we have representatives in parliament already talking about this, then that shows that in Kenya there's a form of a collective voice when it comes to the different stakeholders, when it comes to ensuring we have the right laws and policies to curb the burden of NCDs. Thank you.
Excellent. Great to hear about all of this action and energy in Kenya, Martha. Joy, I may actually direct the next question to you and talk about Nigeria. We just heard about all of the work and the engagement that is happening in Kenya in this space. But in your case, in your work, you engage as well with a large network and group of actors, and at different scales in particular, so national, subnational, and the communities. I assume you use different strategies depending on the audience and the message, even though the objective is the same, healthier diets. Can you share some of the key principles in your work as you navigate these different spaces and work towards this goal of healthier diets?
Oh, absolutely. Thank you so much, Madiha. Hello, everyone. It's really a pleasure to be here. It is true that we are working at different levels of government and public engagement, adopting a multi-sectorial approach. And at GHAI, our efforts in countries are largely driven by our local partners. So in Nigeria, we have adopted a principle across all of our efforts, which is to make the governments and its people own the process. So this singular principle allows our strategy to be tailored to political context and the public health needs. So mapping key stakeholders such as policymakers, influencers, front groups, even potential oppositions at all levels is critical. Some policymakers become policy champions, serving as strong and credible voices during engagement. Our partners also lean on multiple voices from civil society organizations with like interests, youth advocates, experts in diverse and relevant fields, and the media, thus building strong coalitions of advocates. And furthermore, which is my last point, they design messaging that utilizes global data, and in most cases, they support in the generation of local evidence, translating this evidence into policy briefs, opinion articles, and other materials targeting different audiences. And in turn, the audiences use the materials to demand for policy change at the grassroots level and also inform policy decisions at the grass tops. So all of these cumulatively inform our strategic engagement, our arguments, our successes, and ultimately our policy wins.
Great. Thank you, Joy. That's really interesting. And as you say, I see a lot of similarity in some of what was shared with our colleagues from Thailand and Pakistan, and of course from Kenya. I'm going to shift focus a little bit and perhaps move to yourself, John. At Tax Justice Network Africa, you and your team, you work on transparency, accountability, and good governance for tax systems. And how that's relevant for our work is this includes taxes on tobacco, alcohol, and sugary sweetened beverages. And you have a wider perspective because you work across Africa. Could you share with us perhaps some of the biggest challenges as you engage, particularly at the government level, but with different groups on the challenges in getting change, tax systems, improvements in place, especially on unhealthy foods?
So, thank you very much. And I must say it's always a pleasure to be engaged in such discussions because it underlines much of the work that we do. And also it exposes the understanding and the appreciation of the advocacy that we all do for the sake of good public health policies into place. So in terms of the challenges that we face during our advocacy and the quest to have good policies into place, one is the issue of the existence of multinationals. And of late, one of the things that we've been trying to question and try to intervene as much as we can is questioning the power and accountability of these multinationals that exist in this specific space. So, for instance, we have multinationals like the big tobacco industries, the likes of BAT, the likes of Philip Morris, and even to some greater extent, the likes of Coca-Cola and the rest. When you look to the extent of which they are able to influence policies across developing countries as compared to developed countries or those countries in the global north, we realize that their intervention in policy process making is quite high. And the level of interference in terms of ensuring that policies that govern food policy and health in particular are either weakened or they are watered down. They are not as strong in terms of enforceability. The access to public participation in civil societies in the policy-making space is reduced. And with that, they're able to run away with some of policies or their actions that are supposed to be questioned. Secondly, when it comes to the role of tax in terms of curbing consumption of these products, and also in terms of ensuring that there is equity when it comes to the impact that comes after consumption, you realize that the tax rates that they are charged against the effect or the impact that they cause on consumers and the different economies is quite high. And therefore, one of the issues or one of the major challenges is that we've allowed, or our governments have allowed, the multinationals in this space to have much power and influence on the policies that come into play. Yeah.
Thank you so much, John. And no, it was interesting that even in our conversation, whenever I was presenting my work on Pakistan, and that came up, how to counter industry messages. And I think that that's interesting to think about when we're talking about messenger and the message. It's not just about the positive side and about the change that needs to happen. We also often have to act as a shield and to filter through perhaps the misinformation that may be crowding the field and preventing action. I'd like to stay on that topic a little bit, and Martha, perhaps I'll move to you and ask in the Kenyan context. Again, you've been engaging with your large network of collaborators on several different policies. Have you encountered or engaged with the food industry in any of this work? What has been effective or useful in managing perhaps interference or conflict in this space?
Thank you for that question. So for the past around 2 years, we've actually been actively working on the development of the laws and policies. So in this process, the industry has actually not been actively engaged in this because these are issues of public health that we have been dealing with. So when it gets to the stage of public participation and stakeholder engagements, that's the point that we intend or we expect to have probably some form of not only industry interference or industry questioning the types of laws and policies that we are pushing forward. However, when the nutrient profile model was passed in Kenya and publicized by the Ministry of Health, that is last year, that's when we started getting some response from the industry. That's when we started seeing articles here and there in both legacy as well as social media. So different messages being passed by the industry. However, we have not had any form of direct contact, especially to us as civil society organizations or specifically for KELIN. However, that is something that we expect once the Ministry of Health publicly invites views on these draft laws and policies before they reach the point whereby they're being passed in Parliament. So, however, what so far from the form of response that we have gotten from industry, we are just being diligent in sharing factual information about the burden of NCDs, the importance of having these policies, whether it's fiscal policies, food procurement policies, or restricting marketing of unhealthy foods to children, because that has also been a surge when it comes to commercialization of foods that can be considered unhealthy for consumption. So we are just sharing information, and we are doing this with a common voice from the different actors that I mentioned earlier. Government, we're also having discussions with other stakeholders like the judiciary. So it's not only legislature, but the judiciary, legislature, as well as other like-minded or relevant institutions, and also sharing this information with the community such that when they're the ones with the purchasing power. So when they're purchasing foods, they're sure or they're informed of the type of content and the harms that are contained in the foods that they're trying to consume. Thank you.
Thank you so much, Martha. And I think that points to the amount of preparedness that needs to be in place to be able to have ready messages to go out, crafted for each particular audience, and to combat perhaps misinformation. Joy, I'd like to pick up on another theme that has been in this webinar. We just heard Munawar speak in Pakistan about their model for youth engagement. I'd like to ask you about your work and how an example of how you've worked with youth to make an impact on strengthening healthy diets.
Absolutely, Madiha. So our experience in Nigeria with youth engagement, youth advocacy is very similar with Pakistan experience shared by the second presenter. So one of our local partners, the Corporate Accountability for Public Participation Africa, CAPA, lead what they call the Healthy Food Policy Vanguard, having young people from higher institutions, young professionals across diverse fields in health, scientists, journalists, community mobilizers, and a lot more. And currently we have over 170 youth advocates across spread across the different parts of the country. We strengthen their capacity, we build their knowledge, and then they engage at all levels, federal, state, and community. They also engage heavily on various social media platforms, leading press briefings and other media-related engagements, resulting to increased awareness and a lot more. So recently, at the public hearing on the amendments of the bill on sugar, sodium, brevet taxes in Nigeria, this youth vanguard made a presentation to legislators, sharing the impact of unhealthy beverages on youth and how they have been targeted by food and beverage industries. And they have also organized several school outreaches, advocacy visits to political, religious, and community leaders. And their diversity ensures that the advocacy is both technically sound and socially grounded, with passionate voices that speak across professional, academic, and community spaces. So we've done a lot of youth engagement, and it has been wonderful, honestly.
Great to hear. And yes, I think the energy and the passion that youth bring is essential, but often they're not given that space to lead the change. So good to see that model in place. John, coming back to you, and I think hearing, as we say, the different experiences across the regions and the countries, there must be a lot that resonates and is similar, even though, of course, we have to work in different contexts and just be critical to that. Do you have any insight from your work on what factors might be relevant or how we might want to think about making progress at a regional or a cross-regional level? Where do you see the most opportunity for progress and collaboration?
So, buying from several models that have really worked in terms of having an efficient policy into place, because having a policy into place should equally be backed by willingness, that is political willingness, and also enforcement. So in our experience and what we are also trying to advocate in order to ease the resources that go or support enforcement is having regional policy into place. So, for instance, in Africa, we talk of East African Community. We talk of another regional economic community called SADC in the south. In the west, there is the ECOWAS. And good enough, we also have the African Union, which is a continental body. So if we have a harmonized policy in place and the countries now work on enforcing them, it becomes very easy. And so from our experience, and one of the things that has really worked, for instance, in tobacco tax policies is the one in ECOWAS, where they have a harmonized tax policy for tobacco and tobacco products. And it is easy for them to enforce, because when you move from one country to the other within the same region, you easily reduce the issues of illicit trade, you easily reduce the issues of peer comparison of different tax policies. And therefore, we hope that in the near future, the East African community, the SADC in the south and ECOWAS in the west, will end up having a harmonized food policy that will also be easier to enforce. At a global level, and having interacted with some institutions and civil societies from Asia, we as the civil society organization are championing for a UN protocol. So we know that the discussion on UN tax convention is at an advanced level, but there is still room for a health tax protocol to be embedded into that process. And therefore it will ensure that at a global level, we have an equal footing for each of the member countries of the UN. So that is one of the issues that I think will help advance this discussion and also strengthen the existing policies or the policies that we are working towards having into place. Yeah.
Thank you. That's a great insight. I know from our work here at IDRC, as we work globally, there are often these questions that come up from our country research teams on learning from other contexts and interest in having a shared protocol and approach. So I think something like this UN tax protocol would be really useful. We've seen how effective that has been, particularly on tobacco, having certain rules in place that then against which you can build or strengthen your in-country standards. On that, actually, I might just open the door back to Martha. Is there anything else, given, again, work in Kenya and now often work in Kenya and in the region, there's a lot of interplay and learning. Is there anything you might want to add to this, or insight on how a regional approach might be useful as you work and you collaborate on this work towards healthier diets?
Yes, definitely. Just as John has said, there are different economic blocks, different international or groupings of countries and institutions that are relevant in this discussion, because some of them are in charge or are tasked with the mandate of coming up with regional policies. So having that collaboration across regions is very important. I know in the sector, a lot of civil society organizations collaboratively work together and pick best practice from the different countries and the different institutions and apply the same to our different local contexts. So for example, we work closely with our partners in Uganda and Tanzania because we have realized that we're all moving towards ensuring that we have evidence-based policies, fiscal policies, and other laws and policies around healthy diets. So in that same wavelength, we've also seen development partners working together collaboratively because they identify that the different institutions that they're working with are also working collaboratively. So structuring projects and structuring advocacy in such a way that it can be shared across different regions is something that we have seen in the past few years working very well. And we are continuing to lead discussions around the East African context in Africa with different groupings, specifically pushing for evidence-based food environment policies. So I think this is very important, and we can benefit greatly from learning for what different methods and mechanisms different countries are using to ensure that we have these policies and that these policies are implemented. And hopefully we can have regional policies that can be locally adopted in the different countries, as long as we are speaking with one voice and we're all chasing the same goal. Thank you.
Thank you so much. I think we are at time. This was really great. I really appreciate all of your insights. But I think we do have to switch to a more open question and answer session. So we have an opportunity to hear from all of the different people here today who also will have their expertise to share. Before I do so, though, I just want to check. We've had a very Africa-focused conversation in this panel. And as we move into the more general Q&A, do you have any questions either for the speakers before us or to the audience that is here? And perhaps starting with you, Joy, but Martha and John, please come in. If there are any specific questions that are burning and you'd like to pose to the group as a whole.
Oh, yes, Madiha. So, you know, in Africa, in the African region, we're seeing a lot of similarities in terms of industry influence, common challenges when it comes to unhealthy food products, challenges when it comes to intervening for healthy food policies or setting healthy food policies and priorities. So it will be interesting to learn from the Asian region, which I believe is more advanced, how they're able to, you know, better collaborate, set regional policies, address industry influence and lobbying to governments within the region, and basically just working together to address the increasingly unhealthy food products, food consumption, and just creating a unified voice within the region. It will be really interesting to learn from the Asian region how that has been adopted, how that has worked, and hopefully how we can adopt it within the African region as well. Thank you.
Excellent question. And I will ask all those in the room to have a think because we may come back to it in the Q&A. Martha or John, anything you'd like to add either to your comments before we close or a question that you might have for others?
So mine will be more of an addition and probably just to what I know most of us are doing is to look into the linkages that issues of health and harmful products have, because most of the time we've been addressing them in silos. The impact that comes goes over and above the health issues, goes over and above tax and income issues, because it's a matter of human capital development. And whenever we talk of our citizenry being affected and not being productive, it goes beyond just being the single consumer, but it becomes a household and fully an economic issue. So when we look into that, it will help us fully understand and also be able to convince the different policy makers in place. Yeah, thank you.
Well said, John. Well said. A last word to you, Martha, before we move on.
Yes, thank you. I think I'd like to pick up from where John left. I know when it comes to industry interference, and also probably one of the main key issues of contention is usually the trade aspect of it. So I think it's always important to remind each other, that is the different stakeholders as well as the community, that I think the public health interest supersedes the trade interest. So if the populace is healthy, if the populace has access to healthy foods, and if the unhealthy ones are restricted, whether it's through fiscal policies or whatnot, it's important to ensure that the superseding factor is a public health factor. And that is one voice that we need to speak as, or we need to speak of, not only as Kenya or Africa, but as the whole world. So we hope to learn from the different contexts, whether it's Asia, Africa, or even the wins from that we've seen in Latin America and other countries. Recently, we saw that the UK also has made different laws that are making waves when it comes to healthy diets. So I believe, yes, speaking in one voice and letting the whole populace in the world see the importance of upholding public health. Thank you.
Absolutely fantastic. With that, thank you. Thank you all. Please, you will be on the line. Feel free to come in if you want to add or clarify anything as we move into the discussion. But with this, I'll move into the general question and answer bit. As you saw, and our intention is, this is informal. If you have a question, feel free to either post it in the chat or to just unmute yourself and ask it. It doesn't have to be a question. It could be a response to something the panelists or the speakers have said or that you may want to add. I'll start with, because I can see Lisa right there. Please introduce yourself very briefly, quickly, Lisa, and then go ahead.
Yes, hello, I'm Lisa Antillon, and I work with the Global Hub for Health and Food Policy Innovation. We are a part of the National Institute of Public Health of Mexico. And yes, so it's been a pleasure to listen to all the participants from Asia and from Africa. And this hub has been created to share experiences between health ministers and under ministers and other key policy makers from Mexico with their peers in Asia and Africa in order to advance the policy agenda in the 4 topics that were spoken about before, no, taxation and restrictions on marketing, etc. So definitely we would like to propose, no, to go on the idea of speaking as one voice throughout the world, no, and the way to do this is to increase collaboration between regions and to put so public health supersedes any other topic regarding economics or whatever. And so I'd like to make an invitation to all the panelists and everybody that's listening to us to contact us, please. I can give you, I can share an email.
Yes.
Yes, because we will be working, we have funds to bring people to Mexico. Mexico has had best practices in all 4 topics, and we would love to hear what you're doing in your countries and share information and just move the policy agenda forward worldwide. So thank you very much for this opportunity. And I look forward to meeting you all and working with you.
That is absolutely excellent, Lisa. Please do share your details in the chat, and then we'll have people contact you. And in fact, that's an excellent point. There again are people here from all over the world. I thought given the time zone, we may not have been able to touch the Americas, but I was glad to be wrong. So if you do want people to contact you or reach out to you, please, the chat is a great function. Share your email or your contact details. And then with that, perhaps I can't see everyone on screen. We are around 60 people. So either you will have to raise your hand or unmute yourself or post a comment in the chat so we can speak to you. And especially if somebody wants to come in and answer Joey's question, I thought that was a really good question to ask about how Asia or those who are working in Asia have seen progress on regional collaborations, etc. If there's someone who wishes to speak to that.
Madiha, I have
Please.
seen the hand raised. Yeah. This Mr. Sanahula. Yeah, sorry if I pronounce
Sanaula,
mispronounce.
yes.
Yeah.
Please come in and unmute yourself. Go ahead.
Thank you very much. It was a great honor for us for this important program, part of this program. My question it will be my request that as a civil society we cannot beat the tactics of industry. So we create a coalitions with the partners. We have the relations with the parliamentarians, policymakers, even religious leaders, civil society, even youth. And as my brother Munawar Hussain said, we got the two victories by beating this industry. Is there any approach to beat the industry tactics? I want to learn from the world experience. Thank you very much.
That's a good question. And I think many here will have done some work on this. I know there was conversation earlier about perhaps sharing toolkits and crafting. I know especially those who worked in tobacco have worked on having ready-made messages completed. And a lot of what you've spoken, what you've done in Pakistan is about also having different people speak to different messages on this. But I would like to cede the space to those in the room who perhaps have had more direct experience on this, and who might want to come in and add to this. I know we also have in the room Dr. Wiwat, who is the chair of the steering committee on health promotion and reduction of risk factors for NCDs. Dr. Wiwat, are you with us?
I think he's not here today. He cannot
okay.
make it today, but we have another stakeholder from Losol Network. Yes.
If they are here and perhaps they might want to come in and share their experience in general in advocating for lower salt and countering industry messages. Dr. Surasak? Yes.
Yeah, thank you. I'm Dr. Surasak Kantachuvesli. I'm a nephrologist. I'm the chair of Thai Low Salt Network. We're working on the salt reduction campaign in Thailand for more than 10 years. And we work from public education, from research work, and law and regulation about the for OPEC labeling and sodium tax. Lastly, we try to push for sodium taxation in the snack and in the instant food like instant noodle and congee. So we set the committee with Thai Health Promotion Foundation and Mahidol University and Ministry of Public Health and Ministry of Finance like a committee to plan for sodium tax in these food items, and we propose this to the government, and the director of excise department already agree with that, but for a year we cannot pass the regulation or this of the sodium tax, perhaps because the industrial interference, I would say, or lobbying, because even though the minister of the finance already announced that the sodium tax will be implemented this year, but so far, I mean, last year, So far is in on the in the pipeline of the Ministry of Finance policy that will be implemented this year. But we work on the many research work to support policy implementation, like impact of sodium tax on public health, on the economy, on food price elasticity of the of these food products. But so far we hope that the after general election this month, the new government will implement the sodium tax quite soon. But we have a group of the committee that working on this. Thank you.
Thank you so much, Sarasak.
Yeah. Yeah. The last thing is when I talked to the Ministry of Finance just this month, they said that it may possible that we'll start from the snack first for the sodium tax, because it will not affect the poor people, and it also help to protect the children from the snack. Thank you.
No, that's interesting, and it's often like finding that entry point for change to start. But no, great to hear. I actually perhaps might ask our colleagues, either John, because I know you've also spoken much about this, about sometimes how individuals within governments and legislators can be more responsive for different reasons to industry or economic arguments such as, employment or corporate taxation, and how what might be good strategies for pushing back on that. I don't know, John, if you wanted to come in. Else, I also see that we have with us Abayomi Sarumi. And I know you've done a lot of work at CAPA on this. So if either of you want to come in and perhaps comment.
Yeah, so on...
Yes, thank you.
Okay,
go ahead.
Thank you. Thank you. When it comes to policy interventions, and sometimes when we advocate for progressive tax measures, you realize that because of the corporate power and to some extent reliance on the industry, tobacco industry, alcohol industry, and the rest of them, they tend to put across economic arguments, because you realize that when it comes to tax policies, for instance, the Ministry of Health might not have much say as compared to either the Treasury or the Ministry of Finance. However, an argument that can be put forward very well by, be it within government itself or civil society organization, is a holistic approach to addressing of these matters. Because you realize that when a population or a citizenry is affected by consuming harmful products, the end impact is the increase in health costs. So you realize that the investment on health sector is wasted or is watered down by you ending up treating NCDs, non-communicable diseases, which could be avoided. So when you do calculation in terms of the cost of treating a single cancer patient vis-a-vis preventing, you realize that the revenue that is earned from these industries is much less as compared to the cost that you incur in terms of treating that patient. For instance, 2 years ago, we did a study within the Civil Society Consortium and realized that for a single revenue, $1 revenue obtained from the tobacco industry, the government ends up investing or spending $3 in terms of mitigating the negative impact that comes from this industry. In terms of employment, when the industry puts forward issue of reduced employment when taxes are increased or these industries are closed, you realize that it doesn't stop at that point. When you look at the whole supply chain, actually the real argument comes in terms of not how many people will be laid off, but how much will be diverted to the other industries. So if a person is, for instance, selling tobacco products alongside other products, be it in a supermarket, be it in a retail shop, by dropping a single commodity from their line, because the industry now argues that it has employed all these people, by dropping a single commodity in their line does not mean that they'll close down their supermarket, does not mean that they'll close down their restaurants, does not mean that they'll close down their small shops. Just one product cannot end up shutting down that whole supply chain. So those are some of the arguments that industry tries to use, and they try as much as they can to get access to the ministries of finance and sideline the other ministries. So for instance, when you talk about WHO Article 5.3, it is our wish that we read it in totality so that the interference does not seem to only affect one ministry, which might not have much say when it comes to economic issues. Yeah, thank you.
Thank you so much, John. I think that's very insightful. I still remember when globally there was this push to ban tobacco in sporting events and sports marketing, and there was this whole thing, oh, but we will have no more sports events without this marketing money. But actually, no, other industries stepped up to provide that support. Abayomi, I also wanted to come to you.
Thank you very much. Thank you for giving me the opportunity. I want to say a very big thank you to the organizers, the speakers, and the panelists. And I think John has done a very incredible job in explaining how we could argue against the industry narrative. I think, I believe that Joy mentioned, Joy Amafa, thank you so much. She is the in-country coordinator for DHR in Nigeria. I'm so pleased to hear how well you explained the work that we are doing in country. And one thing that you said about a singular principle across board that has helped us to strategize well also included our understanding that the way people relate with food matters is different from the way they relate to the issues of tobacco and alcohol. Food happens to be a component of their life that we cannot wish away. Whether it is healthy or unhealthy, it is still food. Then we need to get to the point where we can separate it. So knowing this made it very easy for us to be able to build consistently the messaging that needs to get people detached from the false narrative of the industry. And because our plan is to ensure that the people own the process, our industry strategy was not separated from the whole campaign. It is a component of the campaign. We do not take industry strategy as an afterthought. When a campaign is planned, we plan it all along. And thankfully, we have the benefit of doing tobacco control. So we've had the experience of campaigning against the big tobacco. So what do we do in this space? I do not want to repeat all the things that John had mentioned, but we must ensure that these messages are humanized. People must see the faces. And I think what gave us that a very good opportunity to do that was when we were campaigning for transfer regulations in Nigeria. Unfortunately, it was a fortunate period for us because COVID was rampaging, but we were able to bring the issues of comorbidities into our messaging. So we built our data around human beings. And at that point, it was so hard for anybody to make economic arguments against lives that are being lost. And we've done that consistently and even more intensely with SSB tax campaign in Nigeria right now. And we are also using that model in our Salt FPL campaign. It does not matter what food campaign that we are running, the industry would always have an argument against it. But the people must be allowed to understand that there have been the choices that they've made, that they assumed that were intentional choices of consuming ultra-processed food they must be allowed to get to the point where they see that they are being railroaded into making these choices. So when they get to this point, it is easy for us to now be a mass movement of all, a movement of people who by themselves begin to ask questions against of the industry. And that's what we're seeing in Nigeria right now. People are picking particular products, asking what is the sugar content of this, why is this product different from what is sold in other countries. And I think if we are able to do that on a scaled level, on larger level, we'll begin to win the fight against the industry, as we've seen in many other places. Thank you very much.
Thank you so much, Abayomi. And that additional insight from Nigeria's experience, I think, is very, very welcome. I think another reason why we are convening these cross exchanges. I'm looking at the time. We only have about 10 minutes left. So I strongly encourage people to please come forward if you'd like to make a comment or ask a question. I noticed Surasak has talked about, and this is pretty common actually, we see this in different industries as well, in that if you ask for reformulation or if you ask for change, there is a transition cost, even front of pack labeling, etc. And that there is an argument for it. There is a cost of implementing any new policy, but often one has to be creative in that response to it. So for instance, in salt, we already know that in reformulation, adding, I don't want to say potassium here, but there might be experts here. There are some alternatives which can really help with the salt reduction without affecting flavor too much. That is not very expensive. There is the second argument that John has said about taking a holistic view, and I think that is always very important when we're talking about public funds, because there is a fixed budget. There are multiple things that the government budget and public funds need to be allocated to, and being able to make the argument that if we provide this funding to this industry here, this means money that is taken away from, given a fixed budget, from healthcare, etc. And here, looking at that holistic view about the shift in salt actually has such a large healthcare impact and reduction in healthcare costs that bang for our buck, and in terms of benefit for the public, this is why it makes sense for us to do this. A third thing sometimes is actually challenging or having hard numbers when we do get industry estimates, which sometimes are overly inflated about the cost of transition. I'm actually thinking very much about in Singapore, when they came up with the front of pack labels, which were mandatory, and they got a lot of pushback on, but it is very, very expensive to do this change, to change our manufacturing. And then the Singaporean government said, actually, here are stickers. Stickers are very cheap. Just add the stickers on to your package. You will have enough time to make that change at a lower cost. So, I mean, even while being empathetic to some real costs of transition, I think there are other ways around this to combat perhaps what may not be the most accurate reflection. But I think in this, as always, I think the takeaway here, Surasak, is it helps to speak to others on this. And I think this goes back to, we saw two different geometric models today. We saw the triangle that moves the mountain, and we also saw the circle that leads to transformation. But in both of those, it was that collaboration between those that give you the research and evidence information, as well as those that do the communication with all of the different groups that need to be involved, which includes communities, youth, civil society, legislators. We even actually spoke about the justice system and judges, etc., because a lot of times they're the ones litigating this work. Parliamentarians, government departments with more power, such as economic ministries, and those perhaps with less power, such as ministries of health. But whereas we said the the primary interest remains public health. But this is an opportunity for others to exchange. I see, yes, Abayomi, thank you so much for sharing those resources. I think that's a great resource for anyone else who might want to read that. And I think, again, there's a lot to learn. This is Nigeria specific, but I think anyone reading this might find tactics that resonate in their own country and their own region, and might be able to learn from here. With that, though, I want to make space. Anyone else would like to come in?
Yeah, Surinya, Dr. Surinya, please.
Yeah,
Yes.
because I was waiting if there are any participants from Asia would like to come in to answer Joy's question, which I think that's a really great question. So if no one else come in, I would like to answer, but I should say that it's just my view regarding the unified regional voice in Asia. To me, I think Asia has not quite come together yet as one unified regional voice in the way we see, from African countries. And most of the action on tackling unhealthy food environments in Asia is still happening at the country level. But what I see is that the challenges look very similar across the Asian region. Unhealthy food markets are expanding quickly, and governments, as we learned from colleagues in Thailand, our governments are facing a lot of commercial pressure. And we learned that creating healthy food environment is not an easy job. We learned from African country that it's not one policy that can solve this problem. We need a connected ecosystem, tax level, retail laws, and all must work together. So what I learned from working with people in Southeast Asian country, I think we are starting to see more countries learn from each other. And now we start having a great initiative like Shape Asia. I think Elaine can share a bit more about Shape Asia, which has just started. And I think this initiative is going to be a really encouraging step forward to bring, the collaboration, conversation together at the regional level. Particularly, when we talk about countering industry interference, regional coalitions, I believe, can play a critical role in, tackling the industry interference, as well as strengthening government and industry accountability. Yes. Elaine, would you like to share about Shape Asia or something?
I was going to say the same, Elaine, please. Yes, I think it would be fantastic, please come in if you are still online, but please do, I think, add the links in the chat. There's a lot that we are inspired from for the work that in Latin America, for instance, networks such as Colanza have led. So I think there's a lot of opportunity to learn from that joined up collaborative approach. And yes, I think it'd be great if people can learn more about the Shape Asia initiative and that opportunity for learning across each other. Yes, please, Elaine.
Thanks, Madiha, and thanks, Surinya. So just a very brief introduction about Shape Asia. It's a regional collaborative learning network where we're bringing in together food environment stakeholders across Indonesia, Philippines, Thailand, Malaysia, and Sri Lanka to advance equitable and inclusive food policy solutions. So we envision to shape an inclusive and healthy food future for Asia together. And our mission is to strengthen food systems and policy environments through collaboration, evidence, and advocacy. Yeah, so we started with this year. We are our entry point is in food marketing and food marketing and food retail, and we started to have engagements with different actors across the 5 countries that I've mentioned. So basically, our goal is to generate evidence to advocate for policy innovations and to communicate what we want to advocate for. Yeah. So. And hopefully we could encourage policymakers to improve policies that would lead to better public health outcomes. That's it from me, from Shape Asia. And I'll send the link. I'll send the link about our LinkedIn account and also our website through the chat box. Over to
Great.
you, Madi. Thank you.
Thank you so much. I will close here. And just before I hand back, though, I want to encourage everyone who is on the line. This was a fantastic conversation, but you'll notice people have put in resources, their email details. Please do follow up. As you will see, there's a lot of interest and motivation. People want to help, want to learn with each other. So please go ahead. And if you have specific questions, if you want to follow up and learn more about a context, please contact the people as through their details below, because essentially it is only together that we will be able to make change. With that, I hand back to Saronia, and then I think we can.
So thanks very much, Madiha, and all the participants. Unfortunately, we have reached to the end of this webinar. Everyone would agree with me, the vibrancy of this discussion truly proves how much this topic, taxing unhealthy policy, resonates across our sectors and across the continents. Before we conclude this webinar, please again join me thank the distinguished presenters, panelists, and moderators to dedicate their time and energy to share their long and invaluable experiences with us. I also want to convey our deep appreciation to the team behind the scenes who made this webinar possible. Associate Professor Srinya Punkert, Lead Coordinator of the Food Policy Research Cluster at IPSR, and the entire IPSR backstage crew. Last but not least, allow me to announce the next topic in our webinar series, From Local to Global Impact, Regional Collaboration on Food Environments in the Global South. You have heard a little bit from Eileen and Dr. Srinya, for the work of Shape Asia. And if you want to learn more, please keep your eyes on our next webinar. The next webinar will dive into how we can strengthen our collective voice across borders. We have not firm with the exact date and time, but we will be sharing the announcement with you at the very soonest, and keep your eye on your email inbox. We wish you joy our next webinar, and thanks very much. Enjoy the rest of your day.
Thank you.
Thank
Thank you
you.
all.
Thank you.
Thank
Bye.
you. Bye.
Bye.